Hi everybody, we're here at the Medical College of Wisconsin and we're talking about awake surgery. Dr. Miller, sitting right next to me, has been doing this surgery for decades.
Yes. Yeah, so we don't do this as a parlor trick, but there are times when people have areas of the brain that are dedicated to certain functions and get an abnormality in there, where we, in order to remove the abnormality, will do an operation with them awake. It's surfaces every once in a while as a seemingly brand new idea, but in Montreal they were doing these things back in the late 50s. But it didn't become very widespread until the early 90s. So we do a fair bit of awake surgery here. It's a big team effort. We have a very superb neuropsychology department at MCW, and they have developed ways of efficiently testing people while we're operating so that we can kind of do these things quick enough so people can tolerate it. You don't want to keep somebody awake for 8 hours while you're working on their brain. You'd like to make it brief so that they can not have it be a bad experience.
Dr. Miller, who was, I'm sure you don't know this off the top of your head, but I want to know how they got the first person in the 1950s to volunteer to be the first patient.
Yeah, no idea. And if you read literature from that era, so the ability to operate on people awake is interesting if you're a scientist. You never want to be interesting to a scientist, like ever. But it's interesting because it's the one place we can study language. We can't study language in lower animals and primates or in fruit flies, but because it's a uniquely human experience and a uniquely human attribute. So the doing awake operation has always been intimately tied to people who are interested in figuring out how language works and how memory works. The first literature that came out of early studies, we do a lot of stimulation mapping, and they stimulated things and made reports that nobody else has been able to reproduce.
No kidding.
Yeah, so I think they probably found some answers that were unique and didn't correlate to how things are put together. But it's become much more scientific alongside of the growth of MRI scanning, so we can identify exactly where we are. We can look at wiring diagrams in the brain and try and make correlations. It's very interesting, but we don't do it just because it's interesting.
Oh, obviously. So if I were undergoing a procedure and I was having a brain tumor removed, what kinds of activities would I be doing while you're performing that surgery? I'm sure it depends upon where the placement is in your brain.
Yeah, so the neuropsychologists and our radiology group, our neuroradiology group, have become very sophisticated in their analysis of MRI scans and analysis of what you would find in certain areas of the brain. They do a lot of in-depth testing beforehand to see where people have deficits and see if that correlates with the problem. And then pick what to test based on the location. So it's very individualized for each person.
Sure.
We often operate around areas for movement or around areas for language. Sometimes vision. And other things get a little more esoteric than that.
So it really depends again upon what is being operated on, where
the location is.
Where the location is, sure. I'm here with Dr. Sarah Pillay and Dr. Alyssa Butts, and we're going to be talking a little bit more specifically about some of the activities that you do while awake surgery is going on.
Yeah. So right now you can kind of see in Dr. Butts' lab we have dual iPads, and they're mirrored so they talk to one another. And what we can do is, based on where the tumor or the areas that they're going to be operating, we can choose very tailored and specific tests that are most sensitive to picking up on strengths and weaknesses.
Okay.
So for example, we have different, what we consider kind of cognitive domains. So example, language is a domain, or memory, or something like that. And we can kind of click on that, and then we have lots of different options of different tests that we can choose. And a lot of these tests were actually developed here at MCW. And I think this is a great example of how we've taken basic science research and translated it into the clinical realm. So for example, let's say I'm interested in testing naming ability. So we have lots of different options, but I could select easy, intermediate, or hard trials, and we could start it. And then we could collect a baseline test assessment that would then send over to the iPad that Dr. Butts is holding. This is what the patient would see when we're presenting material.
So as I'm undergoing brain surgery and I have my little halo around my head and you're both on either side of me and we're chatting.
Yes, usually it's just one of us.
Okay.
It's a big team effort on making sure we have coverage 365 days a year.
Right.
We're right in front of you, actually.
Were you nervous the first time that you did this, Dr. Butts? Was it intimidating? Was it like, this is so cool?
A little bit of both,
Yeah.
probably. I think that, it's a service that allows us to work directly with the patient, which I think is a really unique way for us to bring the patient into their medical care in a different way. And so there's something very exciting about that, and being able to tailor, like Dr. Pillay was saying, tailor the test selection that we use based on that individual, and knowing where the tumor is for them and what we need to keep an eye on and monitor, I think is an exciting way to really individualize the treatment for that individual. And so it's exciting, but it is also a little nerve-wracking because you want to do the best you can to take care of that patient and also keep them calm during the procedure too. As you might imagine, it's a big ask to ask the patient to be awake during such a big procedure, and I think that the resiliency of the people that are able to do that is pretty remarkable.
I would think in some ways too, it's got to be a little bit empowering for these patients because you're not just a comatose non-cadaver, you
Right.
know. I mean, but you're
Right.
actually part of the process. And when you and I had the chance to speak on the phone, Dr. Pillay, you said that some people were like, "Oh yeah, I totally want to do this."
Yeah, it is really neat to see some of the things that patients bring to the table, not just us. We've had patients that, mentally practice yoga while they're doing this to kind of relax. And that is just a very unique and special thing to see. And it's not something that maybe we would have thought of
Sure.
as a relaxation technique. And here they are bringing them. We're also learning from them. And so, yes, that can be really a rewarding part of the job.
I just want to clarify one thing. When the patient is brought in, they're not given any pain meds or they're not unconscious, and so how does that all work?
So the patients are given medications to help them relax, but they are awake when they come into the room while we get set up, and then they do go to sleep for a portion of it, and then we wake them back up for the awake.
Okay,
portion.
so I suppose that some of the prep is getting done and that stuff is getting done. They take a little nap and then it's showtime.
And during that whole time, we have a number of team members that are available, making sure the patient is comfortable. One of our amazing nurse coordinators, Linda, is fantastic in talking with the patient, walking them through each step of the way, making sure they're calm and asking how they're doing. Is there anything we can do to help? And this whole time the team is getting everything set up for them, and like you say, then we're good to go for showtime.
Is there an average recovery time when someone undergoes awake surgery? I suppose it's all very much dependent on the individual.
I would say that it's pretty dependent, but I'd like to see the recovery. They get discharged from the hospital fairly quickly.
It's remarkable. It really is. It's remarkable what science what science is able to do. And I want to thank you both for sharing your expertise and your knowledge. And Dr. Miller had shared with us that this surgery has been around for decades, and I had never heard of it before. So thank you so much.
Absolutely.